What if we could not just slow down some of the changes we associate with aging or Alzheimer's dementia, like memory loss and brain fog and forgetfulness? But what if we could actually reverse them? Today, we will learn how by taking a look at the entire body to improve the health of the brain. Hello, and welcome to Elder Health Connection, a podcast where I gather innovators in elder healthcare to discuss their unique perspectives on caregiving and care receiving. My name is Caroline Morris, and I use my combined experience in biochemistry, physical therapy, health coaching, and growing up next door to my grandparents to dig deep into the complexities of aging and then draw out practical solutions that can fit into your life. I record this show from my home in Alexandria, Virginia, sometimes with the input from my dogs, Benny and Barry. Thank you for joining us today. Today, we welcome Dr. Andrew Wong to the show to discuss brain health and all the ways that we can actually impact it in a meaningful way, not just slowing down a disease process, but actually reversing it by looking at the body as an entire system. Dr. Wong is the co-founder of Capital Integrative Health, which is in Bethesda, Maryland, and he practices integrative functional medicine as well as medical acupuncture. He is also the host of the Capital Integrative Health podcast, which I highly recommend. I always learn something when I listen to his episodes there. It was a very, very informative interview, and I appreciate how Dr. Wong really embodies this integrative approach, which means seeing value in many different approaches to health and medicine and not excluding one for the other. And you'll even hear him catching me doing some more comparison or black and white thinking, whereas he has really mastered this integrative approach of bringing the best of everything together so that the body can heal itself and we can live in a more healthful and meaningful way. Enjoy the episode. So today we're joined with Dr. Andrew Wong. Welcome to the show.
Thank you so much, Caroline, for having me. Appreciate it.
I am so excited for our conversation on brain health today. It's such a big and important topic. But before we get into that, could you tell us a little bit about yourself and your medical background?
Sure. Well, I live in Montgomery County, right here in the DMV, and grew up in Virginia, actually in the southern part of Virginia, but moved here over 15 years ago now, and went to school at Georgetown for my internal medicine residency. Before that, I was at Tufts for medical school. And after internal medicine, I worked as a hospitalist at Suburban. And then I started doing primary care at Johns Hopkins in North Bethesda. At that point, after a while, kind of getting more into integrative medicine and more preventative approaches, I worked at Casey Health Institute, which is in Gaithersburg, for a few years, and then started my own practice, co-founded Capital Integrative Health, which is a private practice in Bethesda with a friend, Liz, who's an acupuncturist. So we've had this practice since 2015 and gotten into functional neurology and basically brain health and root causes of brain issues and how to treat that in an integrative way, meaning both using conventional and natural means. For the last 7 years, I would say, is when we've kind of been focusing on that. So that's kind of more about me. And I have training in integrative medicine, fellowship, I've done some medical acupuncture, which is where I learned more of the kind of physical anatomic things. I know you're a physical therapist as well. So I've really learned anatomy more through acupuncture more than medical school. And then I think for the functional medicine training, I finished the IFM certification in 2016. I think for your listeners, I also attended, I think it was 2018, IFM had what's called the Bredesen protocol, which we can talk about today. It talks about ways to treat brain health issues, especially for the elderly, right? Because a lot of times the elderly, there's there's cognitive impairment, there's, mood disorders and things. And there's a lot of things we can do from a root cause medicine approach using physiology to help people.
Very good. And can you tell us what functional medicine is and how it might be different from how you were trained in medical school and residency?
Yeah, so I think a lot of us, including myself, our brains are kind of designed to be dichotomous, meaning it's either black or white, it's left or right, it's right or wrong, it's bad or good, right? So we know that functional medicine is a type of medicine that is not only, I think additive and synergistic with conventional medicine, but I think in a way is really it's really synergistic, so it can really help support conventional medicine. So I would define conventional medicine as sort of the what of medicine. So what is the diagnosis? Is there some, imaging or structural aspect? Like for instance, if someone has Alzheimer's and they might see on a PET scan a decrease in glucose uptake in different areas that are, temporal lobes, et cetera, that are more, consistent with Alzheimer's, that would be sort of like the what. In other words, what is going on? So that's very important to do and to know. And functional medicine, it really deals with the why of medicine. Why did this person get Alzheimer's disease? If someone has depression or anxiety or mood disorders, why do they have depression, anxiety, or mood disorders? So it is really a root cause, science-based biologic approach to understanding the kind of underlying physiology. The way I kind of look at it is if you're driving a car or you know someone that drives a car, and we're in the DMV area, so a lot of people drive cars around here, a lot of crazy traffic. We can see that sometimes cars have problems, right? There's warning lights that come on, or maybe the tire pressure is off, or something. But you'll be driving the car, and then this light will come on. So if I take that car to the car shop, conventionally, like if we just said, well, there's a light blinking, right? Or something is smoking under the hood. Yes, that is happening. That is true. That's the diagnosis, right? There's the label, but we don't know why that car is smoking. We don't know why that car has a blinking light. And that's where functional medicine comes in. What is under the hood that's causing that light to blink or that smoke to go off? So you want to see both. You want to understand, hey, there's a light blinking, there's something going on, and you have to also understand why that's happening.
That's so important. And I think it's an approach that's growing in healthcare, but still not widespread. We both got our start in hospitals. So was there a moment you got to early in your career where you just realized you needed more training to fully address concerns, or how did that evolution take place for you?
Yes. Before I do that, I'm going to paraphrase my friend, doctor friend, about acute care medicine, because I was in the hospital for 3 years, a great experience at Suburban Hospital. I would say Western medicine, conventional medicine, is really good at identifying the root causes of acute care issues. If there's trauma, if there's a broken leg, if there's a heart attack, it's really good at getting to the root causes. I think just to clarify what I said before, root causes of chronic issues that are unexplained, sort of not understood. That's where I think functional medicine really, really comes in. I kind of knew back when I was 17 or 18, when I was volunteering at the hospital locally in Virginia, that I wanted to do something integratively. I don't know exactly why, except probably my mom always cooked organic food, and she kind of helped reverse her own thyroid conditions naturally through organic cooking and exercise and stuff. So both my sister and I are integrative physicians. So there's got to be, I don't think that's genetics. I think that's just like upbringing. And, I grew up in an area where, we were actually on 3 acres, and there was a lot of nature around, a lot of trees, so that probably played a role too, just the interest in environmental science and conservation of the earth and, more natural kind of things there. So I would say those are some of the factors there. In terms of medical training, I didn't really get a lot of exposure to integrative medicine in the conventional medicine training, but it was just because I had this sort of background and this path that I wanted to follow, that I knew I would still do that. So that kind of kept me grounded during that time.
Yeah, very good. It's always interesting to me how people's lives and careers end up where they are, and all the factors that come together. So when we talk about chronic conditions that can affect the brain and the health of the brain, what are some of the top things that you look for?
Well, there's a lot of different chronic conditions that can affect the brain, and the brain really needs sleep. So, sleep is really important for body recovery in general, and then brain recovery in specific. So I would say chronic sleep issues is really one of the areas that we're gonna look for as how's that going to affect the brain. And there's actually evidence now that chronic insomnia and sleep issues can actually affect mood. It can actually be the cause of anxiety and depression. The
Mm,
cause. It can also be the cause, not just like a side byproduct, but could be the cause of Alzheimer's dementia. So these are things that these conditions like anxiety, depression can develop over years. Dementia can develop over decades. Someone with chronic insomnia, sleep is so important for brain health that we really focus on that in our clinic, both for prevention and treatment of that.
hmm
And then other conditions, I would say, when you think about other conditions that people might see, people with fatigue, fatigue is a brain issue. Fatigue essentially means that the brain is not producing enough energy to give you energy to feel good. So if someone has fatigue, and there's some probably body issues too. There could be gut issues, there could be hormonal issues, there could be a lot of things. But at the end of the day, that signal is going to the brain, and the brain's not producing enough what's called ATP, adenosine triphosphate, to make you feel good. And then someone's going to feel fatigue. So I think fatigue is a big one. So I think between sleep and fatigue, those are pretty big, brain issues. And then the other thing is going to be, mood. People with mood issues, we know that there's neurotransmitter imbalances. But more than that, I would say there's brain inflammation. So there's certain combinations of neurotransmitters that will keep the brain balanced, that keep the brain happy, right? Just like we talk about nutrition, like maybe we want to have a balanced diet and eat some protein in the salad and maybe healthy carb or something like that, as an example of what is often recommended. But if someone just ate like one of those things only, right, that's not really a balance necessarily. So the brain's kind of like that. If you have too much of one neurotransmitter, not others, if there's chronic inflammation going on, that can actually cause mood issues too.
Those are things we experience a lot. I think most of us have had some issues with sleep at some point in our life, definitely fatigue and mood as well. And I think what you're saying in there too is it's not just a normal part of aging. I think sometimes people think fatigue in particular is just a part of getting older, of slowing down, but maybe there's something else going on that can be addressed.
Yeah, it is true that as we get older, the brain and the body probably becomes over time slightly less efficient at producing energy. So that there is something to that, but you can optimize your ability to produce energy and stave off fatigue, so to speak, if you do, certain lifestyle factors and nutritional factors and movement factors and everything to help your body, age healthily, right? So people that are hiking, in their 90s or something, or they're farming in their 90s, or even like they get to 100, things like that. That's definitely, you can see that that's not only genetic. I mean, there could be some genetics involved, but we also see that, these people have lived long, healthy lives, probably because of these routines they're doing, these healthy routines day in and day out that they're doing. And I think it's not ever too late either. And we can talk about that later, but, we have stories of people that are, a little older and they're kind of reversing their chronic conditions, or they're improving their brain health. So one of the things that I want to say is that when I was growing up, I had an Encyclopedia Britannica, I believe it was, and World Book and stuff. So World Book Encyclopedia. So I think I had a whole set of World Book encyclopedias when I was growing up. And I remember reading something about the brain at that time, just something that sticks out to me. I don't probably remember anything else from that whole encyclopedia list, but it basically said that the brain health, and just overall physiology peaks at age 29, and basically at age 29, you start losing brain cells and you can't get them back. And this whole theory of sort of like brain decline after the age of 29 was disproven by scientists in the mid 1990s or late 1990s. So at that point, scientists, I think it was 1998, they discovered that, well, actually the brain regenerates at any age. At any age. That means that we can create new brain cells even as older adults. And I think this is a very important finding, and yet I don't think it's necessarily really talked about or understood much in
Mm-hmm.
probably the medical population or the general population. So, people are like, oh, I'm losing memory or I'm having brain fog, I'm feeling tired. That's just aging. Well, yes, like I said, there's some aspects of hormonal levels and neurotransmitter levels and energy efficiency and things that decline, but we also know that the brain has the capacity to regenerate
Mm-hmm.
cells and certainly can also develop new neural networks, right? So you see sometimes, overall brain cell number does decline, but you can still regenerate new brain cells. There's neuronal stem cells that produce more brain cells, and then there's the idea of increasing neural networks to keep those brain cells that are alive more efficient.
Mm-hmm. Yeah, I would say in my work, I see it the most rehabilitating after a stroke where a part of the brain has died, but people can still make significant gains by creating new networks or, working around the areas of injury. But it's also nice to know that we can do that without having a stroke too, and still improve the health of the brain.
Yes.
Yeah. What are some conditions that people should really start to seek a more functional approach to health? So, we talked about some of the underlying issues of insomnia, but what about like a diagnosis they might have that it might be time to think again about the approach?
Yeah, before we get into diagnoses, I just want to kind of mention for people that don't have obvious brain health issues, we all want to preserve our brain health. And I think in our clinic sometimes we're going to look at diagnoses, but we're also going to look at what are the nutrients that the brain
Mm-hmm.
needs to thrive. Because a lot of times when you give the nutrients and the quote unquote good stuff to the brain, then the diagnosis kind of can go away or get better as a side benefit of that. So nourishing the roots, so to speak, to
Mm-hmm.
help the leaves of the tree, so to speak. So I think just to kind of give us like an overview, things that any person's brain would need are oxygen, are light, circulation, like enough blood flow to the area. Certainly, it's different vitamins, like vitamin and minerals called micronutrients, and then macronutrients, so things like healthy proteins and fats would be helpful, and then movement. You need to move as well. So, and then sleep. So I think these are just some basic things just to say, so that really anytime someone comes into our clinic with brain health diagnosis, which we'll talk about in a sec, we're really looking at that first before we say, okay, let's treat this diagnosis. So basically, how's the oxygen? Are you getting outside? Getting enough light to activate the pineal gland and things like that. So are you getting movement? These are just basic things, to help your circulation. How's your nitric oxide levels? Things like that. So from a diagnostic perspective, if someone is starting to get brain fog, what is called subjective cognitive impairment, or SCI, that means, they used to be really sharp, but now they can't remember people's names, they can't remember driving directions, their executive function skills are less, they have trouble making decisions, they have trouble with attention, any of these things. We want to think about, how's the health of their brain. So this could be, there's three categories of cognitive impairment. One is subjective cognitive impairment without any objective, findings. And there's mild cognitive impairment, and you can do some neuropsych testing and things like that to assess that. But often on a structural exam like an MRI, it's normal. And then you have something like AD or dementia, Alzheimer's dementia, or other neurodegenerative conditions in which there's usually structural implications or findings. Like on an MRI, you might have atrophy of the hippocampus, which is the area involved in memory, and you'll see that in Alzheimer's, but you wouldn't necessarily see that earlier in that progression. So that's one condition that people come in with. And then certainly people that have mood issues and trauma issues, they might have anxiety, depression, but also ADD, OCD, PTSD, very, very common actually, probably underdiagnosed, super underdiagnosed. So all those conditions are brain conditions. And what people don't realize, I think, is that the brain is connected to the rest of the body. So if someone might be coming in with irritable bowel syndrome, they might be coming in with chronic pain, right? Or something like that. And a lot of these things are brain issues too. They're not just musculoskeletal or, structural or gut issues, because those are important too. And we want to address that too, but you have to address the brain at the same time. Otherwise the person will not get better.
Mm-hmm. Yeah, it makes sense that it's all connected. I think it's a false separation to think mental or mind or emotional conditions aren't body conditions or vice versa. We really can't separate anything out there.
Correct.
Yeah. And I love that you look at that foundation first, like you mentioned, of are you getting daylight exposure? Are you sleeping? What are you eating? Do you have enough blood flow or oxygen? Because without those foundations, it's really hard to heal.
I should mention too, yes, I should also mention blood sugar regulation. So sometimes people have all these things, but if the blood sugar is too high or too low, that's not good for the brain either. So the brain does need a certain amount of blood glucose or blood sugar. And I believe the brain consumes like 20% of all glucose, in the body. So it's a pretty high functioning organ. There's a lot of stuff going on in the brain, a lot of electrical activity. So we need a lot of blood sugar, blood glucose, sort of like energy going to the brain, but we can't have too much or too little at one time because that causes brain inflammation. That's stressful for the brain. So we want to have a nice steady flow of blood sugar. And so people have cognitive issues. One of the first things we're going to look at is things like a hemoglobin A1C or an insulin level, a fasting insulin level, so we can see, how their blood sugar is. Or they might even say, after I eat a heavy carbohydrate meal, 2 hours later, I feel brain fog. I can't move. I'm just so tired. We know that person is probably eating too many carbohydrates and that they're getting a reactive hypoglycemia, meaning after that heavy meal, they're getting a lower blood sugar, and that's affecting their brain health, at least temporarily.
Mm-hmm. So would you say it's common that you find that there's a blood sugar component to these presentations?
It's very common because 88% of people in the US have metabolic syndrome. This is a research from UNC. And we know that metabolic syndrome means that this person likely has trouble with blood sugar regulation a lot of times. It could be cholesterol issues, it could be blood pressure issues, but overall they have trouble with energy regulation. And this means that they're getting blood sugar in their system. It's not actually getting to the organs, the tissues that it should get to, and it's often staying out in the system. And this means that, that means it's staying out in the system. So that means the brain's getting too much blood sugar, too little blood sugar at any one time. So even if their sugar level looks normal, they might be having what I call like a volatility of blood sugar, right? So I think one way I would explain it sometimes to patients is like the stock market. You want it to be very like even. You don't want it to be like up, down, up, down. That's stressful. And in the same way, a blood sugar being up, down is very stressful to your brain and to your adrenal glands and things like that.
Yeah. So what are some things you typically recommend when you find someone has that volatile blood sugar to help them stabilize it?
A lot of times it's, what we call a carbohydrate intolerance. So carbohydrates aren't inherently bad, but a lot of people eat too many. So we might reduce the carbohydrate load. We might give people sort of these plans for, different things like intermittent fasting, which is a very hot topic, can help brain health. We can have people eat more fats and proteins. We have a whole group of functional nutritionists, naturopathic doctors, and others that are really experienced in nutrition that we can send them to as well.
And then when the blood sugar is controlled, or at least less up and down, what are some things that your patients report as improving?
They can think better, that their memory's better, they have less brain fog, they have more energy, they don't get those crashes after meals. So it's really life-changing for a lot of people. Also, some people get sleeping issues. We talked about sleep in the beginning of this. They have insomnia. Some of that insomnia is caused by low blood sugar crashes in the nighttime. I know several years ago, I was probably not eating as well myself, and I noticed that when I started to eat slightly less carbohydrates and kind of manage like when I'm eating, like timing of meals and things, I wouldn't wake up in the middle of the night hungry, whereas before I did. So now I never do that, probably because, of course, I should knock on wood, never say never. But if I eat more proteins and fats with carbohydrates, then and I kind of time my meals and things, I'll at least do 12 hours on, 12 hours off, which basically means probably eating from, let's say, 7 a.m. to 7 p.m. kind of thing as a default, and then not eating after 7, something like that. So my body's kind of gotten used to that rhythm. So there's no like waking up in the middle of the night feeling hungry kind of thing, which is what I used to do.
Mm-hmm. Yeah. So then you can address some of the insomnia piece too.
Correct.
Through the blood sugar.
Right.
Very good. What are some, let's say the primary issue wasn't blood sugar for someone, what would be the the next place you would look, and how would you address that?
For brain health in general, or I would
Sure.
say one of the big things we have to rule out, and I think this is a very common thing, is sleep apnea. People
Mm-hmm.
have undiagnosed sleep apnea. You don't have to have snoring to have sleep apnea. If they're not getting enough oxygen at night, then their brain will degenerate. It's just very simple as that. So a lot of people with like cognitive impairment, let's say, they actually have undiagnosed sleep apnea. And once you correct the sleep apnea, they actually get much better.
And what are some root causes of sleep apnea?
Metabolic syndrome itself, so just having too much fat and too much sort of inflammation around the airways and the soft tissue there, it can be one of the big causes of sleep apnea. You can have things like nasal septal deviation, you can have sinus congestion and things that impair the oxygen flow just through the nasal passages. You can have also, and our friends that are natural dentists and physical therapists are more experienced than I am about this, but I think you can have myofascial dysfunction, sort of cranial dysfunction and things like that, and the jaw structure will also impact, and I think the mouth the airway diameter rather would also affect risk of sleep apnea. So there's actually, people out there that can help reverse sleep apnea naturally with things like natural dentistry and myofascial release.
Very good. Yeah, I think that is something we don't often think about when thinking about brain fog or depression or dementia. So, great tip there. And like you said, if there's not enough oxygen, we just can't function optimally. Yeah.
Yes, we should talk about the gut because, functional medicine is all about, health starting in the gut, disease beginning in the gut if it's imbalanced. And the gut is actually where most of your neurotransmitters are made. Most
Mm-hmm.
of the serotonin is made in the gut. About half of the dopamine is made in the gut. So a lot of these big neurotransmitters that are involved in things like thinking and mood and feeling happy and everything are made in the gut. And we know that if there's gut inflammation, which could manifest as someone having bloating or cramping or something like that, but it could also be asymptomatic, meaning they don't feel any gut symptoms, but for some reason they're not absorbing the nutrients, and their gut is sort of what we call subclinically inflamed. So they don't feel symptoms, but then when we do these stool tests, which we call microbiome tests, it actually uncovers inflammation. It might uncover gut infections, or it might uncover low digestive enzymes and things. So we do, like in functional gastroenterology, we kind of do these microbiome tests that can tell us if there's anything, quote unquote, under that hood, so to speak, of if there's gut dysfunction. And if there is gut inflammation, then that will deplete the neurotransmitters. It will actually deplete the gut's ability to make these, quote unquote, neurotransmitters, which even though it says neurotransmitters, we should all, and some of them are made in the brain, we should call them gut transmitters instead of neurotransmitters, because they're made in the gut too. And then if they're not made in the gut in adequate amounts, then someone's going to feel tired, someone's going to feel depressed, or have ADD, So all these kind of labels, diagnostic labels, a lot of times, a lot of these mood issues do originate in the gut, and then can be treated from treating the gut as well.
Mm-hmm. Yeah, it's so fascinating. The more I learn about the connection between the gut and brain, it still amazes me, even though it's been around for a little while now.
Yeah,
Yeah.
exactly.
So I think you've given us some examples of how this can really impact people's lives with some of the maybe less severe symptoms like brain fog. But have you seen changes in people with a dementia diagnosis through addressing some of these underlying causes?
Yeah, so we have a patient that has been diagnosed with early stage dementia, and she was found to have sleep apnea. And then, she's been treated with a CPAP, which is a continuous positive airway pressure, CPAP mask. So that's been helping her sleep. She's been taking some supplements for sleep as well. She's also been addressing her vascular system. So we found that she had low nitric oxide, which nitric oxide is a gas that we all naturally make, but that level usually goes down over time as we all get older. And so nitric oxide helps keep the arteries open. So if we have low nitric oxide, we're going to get what's called vasoconstriction, a constriction of the arteries, and that's going to decrease blood flow to all parts of the body, including the brain. So her low nitric oxide needed to be addressed. We make sure she's on some dietary nitrates. We have her see our functional nutritionist. She's eating more salads, eating more leafy greens, beets, and things like that. She's taken a beetroot powder extract as a supplement to help increase that nitric oxide. So it's increasing the blood flow to her brain cells, to her neurons and everything. We also gave her some different things like compounded medication called low-dose naltrexone, LDN, which is a really good medication to help decrease glial cell activation. So the glial cells are these supportive cells around the brain, around the main brain cells, around the neuron. So you have a neuron, maybe for one neuron, you have like 10 glial cells around it to help support the function of that neuron. But glial cells can get dysfunctional and inflamed in the case of Alzheimer's. So you want to actually sort of deactivate or de-inflame the glial cells. So low-dose naltrexone is really helpful for that. So you can see it's kind of a multi-pronged approach. She had some thyroid dysfunction. So low thyroid function can actually impact memory and mood and everything, meaning like a decline in memory, decline in mood. So, we found that she had some thyroid issues, meaning low thyroid issues. We're giving her thyroid hormone, supporting her nutritionally as well, and her thyroid functions better. So with all these things, and she wasn't able to really get around her house without putting Post-it notes everywhere to have a remember task, so she would like put 50 Post-it notes, let's say, around her house. And, this is about 6 months into her treatment. She's not needing to do that anymore. She's able to remember her tasks and be more functional. So she's really the best she's been in many years. And we've done some cognitive testing on her kind of pre and post to kind of prove that her mental status and her brain health is getting better. So for instance, she went from a 1 percentile, meaning she had, she was worse than 99% of people that did this cognitive test, to now she's at the 65th percentile. And this isn't a person with dementia, which, conventional medicine usually says, well, there's nothing we can do about that. Mm-hmm. So there clearly is, but if we find the root causes and address that, then that's where there's hope.
Yeah, that's an amazing story, and some things I want to highlight. Like you said, usually with dementia, the goal is to mitigate the decline, but you're actually finding you can make very large improvements when you address some of these underlying issues. And then the other thing, just to highlight the integrative approach, you're not sending her to 5 different physicians to manage 5 different parts of the body in their own little silos. You're looking at the person as a whole and addressing everything you're finding in this root cause way.
And I will say too, Caroline, that we are friendly with our conventional colleagues. So an integrative approach combines the best conventional and more natural treatments. So we'll make sure that someone with dementia does have a neurologist, and we'll talk with them about, what we're doing too often. So I think it's important for listeners to know that it's not a either or. It's really more of a both and, what would be sort of the ideal situation.
Yeah, I'm glad you brought that up. I think it's nice for people to know too that at least one person is thinking about the full picture as well, and really trying to bring everything together for the overall health.
Yeah, and I think as physicians and clinicians in general, we all just need to be more open-minded and communicate with each other. I think that's the best way that's going to be best for the patient, really.
Mm-hmm. Let's say someone is concerned about their brain health. When would be the right time to reach out for help?
Pretty much any time. I mean, I think there's that adage or saying that an ounce of prevention is worth a pound of cure, right? I forgot who said that. Maybe Benjamin Franklin. Someone way back when said that. And so it's easier to treat someone, with prevention. It's easier to prevent something than to treat something, of course. But I think if someone is really concerned about their brain health, or maybe they even have a family history of dementia or cognitive issues or mood issues even, I think a lot of people now, I know anxiety and depression and all these mood issues spiked up too during the pandemic, let's say. But, I think really at any time someone could reach out. And we actually have what I call a lab test for the brain, So this is a pretty revolutionary idea that really got popularized more out in the civilian population in 2009, called a quantitative EEG. So we actually run that in our clinic here. We try to run it through insurance. We have someone, check that in case anyone's wondering about that. But that is a test that's going to look at brain functionality and the wavelengths, meaning the frequencies of the brain in different regions of the brain, so like the frontal region in the front or the occipital region in the back, temporal region, parietal region, that are involved in different brain functions as the person's doing some cognitive task. So it's a functional EEG as opposed to like a regular EEG that's looking at just a qualitative yes or no, are there spikes in this area or not. This is more of a qualitative, how much brain activity is happening in different areas, and it can tell that person a lot about function. And one thing that I learned, especially this year, is that, abnormalities or imbalances in brain activity is actually the root cause of anxiety, depression, trauma, cognitive impairment. In other words, it's not just that what we see on a brain map in terms of, different colors and, different basic activities of the brain is a consequence of a diagnosis. So in our clinic, we use a quantitative EEG. So it's different than a regular EEG because it looks at the quantitation of brain waves across different areas of the brain. So what that means is we can have someone with anxiety, let's say, that has a high beta wave activity, or we can have someone with depression that has a low frontal wave activity in the alpha region of the brain, which is a certain area of the brain, a certain frequency rather of the brain. Or we can have someone with a high delta activity and what's called a low peak alpha frequency. So there's all these different patterns, and that would imply more of a cognitive impairment, that latter pattern. So what we see in these kind of patterns of brain waves is that they're not only predictive of what's going on, but they're often the root cause of why these things are happening in the brain. So I think this is what, we would almost nickname a lab test for the brain. And this is something that was brought out by a neuropsychologist, Dr. David Hagedorn, back in 2009 after being kind of tested and tried in the armed forces for a couple of decades. It's kind of gotten out to the civilian population fairly recently in 2009. So we've been offering this brain mapping in our clinic, basically how's the health of your brain, since about 2018. And it's been really, really helpful for our patients because we've often had, lab tests for cholesterol or blood sugar or kidney function and things like that through blood work. And that can tell you about physical health, but we never really had a test that looks at mental health and brain health and how that is really showing up physiologically until then. So this is a real game breaker, I think, for the fields of like mental health and brain health, and including in elderly individuals as well.
Mm-hmm. That's fascinating. I think I heard maybe on a TED Talk a long time ago that until recently, psychiatrists and psychologists were the only providers who didn't study the organ they were treating. And this seems like a way, or at least image it or really look into the structure of it. And this seems like a way we can start to look at the physiology of the brain in treating some of these conditions.
Yeah, I mean, it's really whatever condition someone's coming in with, even if it's a gut health issue or hormone health issue or an immune health issue, it's all about brain health. We need the brain for every other organ to function. So it makes sense from a more connect the dots perspective, like a functional medicine perspective, to assess the brain as well. Even if someone doesn't have a direct brain issue, it's going to affect those other organs kind of downstream. So,
yeah, I think you've given us a nice overview of how you approach these different conditions, what sort of root cause factors you look at, both lifestyle factors like nutrition, activity, daylight exposure, and then some metabolic factors with blood sugar and then sleep apnea, and now with the EEG. Is there anything else you want to share with us about your approach or how you can help people with either mood or cognitive issues?
Well, I think on the mood and cognitive issue perspective, if someone has a mood issue like anxiety, depression, or maybe even recognized or unrecognized trauma like PTSD, then we do want to usually use that brain map, whether they are or are not on medication, because that can actually tell that person also, how the medication is working or not working. So that can be very helpful. So that's important. I think from a cognitive issue perspective, we use something called the Bredesen protocol. Dr. Dale Bredesen is a neurologist that was originally based out of UCLA that I think for the first time of several years ago now, within the last 10 years, I would say, he really demonstrated that Alzheimer's, for some people at least, could be halted or even reversed. And this is a game-breaking kind of thing. This is published in journals, peer-reviewed journals. So there is hope out there, and we use his protocol, and we found good results, with it. Not everyone gets the same results, of course, and it's a very multi-pronged approach, but using nutrition, lifestyle, movement, some of the underlying core factors I was saying earlier, using a functional medicine analysis of their gut, their hormonal health, things like that, their brain health. This is really a way to potentially move the needle for someone, for their brain health.
Yeah, it's such an exciting thing to be a part of right now, because Alzheimer's and dementia are such a big problem. And I think what, at least in the people I work with and their family members, what people are the most afraid of with getting older is having a dementia diagnosis, and to know that there's evidence-based work out there showing that we can actually improve this, or at least mitigate it, is so exciting for me.
It is. And I think just another point real quick is that your genetics are not your destiny. There's actually some genes out there that increase the risk of Alzheimer's, namely ApoE4. But Dr. Bredesen showed in his studies whether or not someone had a single copy of ApoE4 or a double copy, he was still able to demonstrate a lot of those people were able to get reversal of their Alzheimer's. So that's why it's important for listeners to know that genetics can be influenced by nutrition and lifestyle factors. A lot of these factors can influence the expression of those genes, so that their genetics are not their destiny.
Mm-hmm. Yeah, it's fascinating.
It is.
Dr. Wong, thank you so much for your wealth of knowledge, the way you integrate all aspects of health, and for sharing with us today. Do you have any closing thoughts for us?
Thank you, Caroline, for inviting me on the podcast. It's been a pleasure. I would say, brain health is something that really we need to focus on throughout our lives. And I think, I think there's a saying again that, small steps every day lead to giant progress. So this idea of we have to, hit a home run and do it all at one time is a myth, right? It's really these small calculated steps. That's where, health coaching can come in, and really kind of being very disciplined but systematic and routine about it. Maybe if someone just cuts out their can of Coke every day, that might be the first step, something like that. Or if they're wanting to move their body more and increase circulation, and they're, sitting on the couch and they have arthritis and things, maybe just moving 5 minutes a day, for the first month might be the first thing to do, right? If they're having sleeping issues, maybe trying to dial back the time to go to sleep from 1 a.m., which is a not good time to go to sleep, to midnight, or something like that. It's not the kind of quote unquote perfect plan, but it's something that's going to move the needle for them slowly if they keep on doing those small incremental changes over time. So that's what I would kind of leave listeners with is, small steps incrementally executed will lead to giant progress over time.
Mm-hmm. And really sustainable progress too. I think we can do a big effort for a short amount of time, but that doesn't always work out. So
in the long run.
Yeah. Okay. And your practice again is Capital Integrative Health. Do people have to be in the area to work with you?
Capital Integrative Health. So we have a website called www.cihealth.org, which is just Capital Integrative Health, cihealth.org. And I think that as long as they can come in once a year to us, we have been seeing some people via telehealth with all the COVID rules and stuff remotely. I think we're kind of more focusing on locally though, people in the DMV, or people that are, if they're out of state, if they can come in to us, at least once, that would be better, I think, here. In the future, we'll probably plan to have a more robust telehealth platform and things as kind of things evolve. But certainly, yeah, we definitely want to see people with cognitive issues, brain issues, which is really can affect everyone, I think, and like we said before, it's about not only treatment, but it's also about prevention too.
Yeah. Wonderful. Dr. Wong, thank you so much. I think this will be an interview to listen to multiple times to really grasp all of the information you've shared with us.
Thank you, Caroline. Okay. Pleasure to be on today.
This podcast is provided for informational purposes only and does not create a provider-patient relationship between us. If you have questions about your health, please speak to a qualified health professional. If you would like to learn more about working with me as your qualified health professional, please visit carolinemorris.com. Did you know that gratitude is good for your health? If you found value in this episode, please share it with a friend and leave a rating or review. To keep the connection going, subscribe to Elder Health Connection on your favorite podcast player to get immediate access to upcoming episodes. Thank you for listening. With love and gratitude, Caroline.